Okay, so welcome, Matt. This is Matthew Hogan. Has been a great patient here at Pinnacle. We call him Super Matt around here because he's done amazingly well. Matt, let's talk a little bit about your knee. So we took care of Matt's right knee, and Matt, you had an injury to what's called the posterior lateral corner. So you'd had an injury actually to this outside of the knee, which had damaged the ligaments of the outside of the knee and created some instability. Matt had been recommended surgery, right?
Yes.
Yeah, so he had been recommended surgery. And Matt, you decided that surgery wasn't for you. There's a lot of downtime there.
Correct.
You'd had this problem for a long time. Tell me, my friend, first of all, let's start with your age. How old are you?
20, whenever I sustained the injury, I was 18.
Yeah.
So I was riding on it for about 2 years.
Yeah, and a real problem.
Yes.
Where you weren't able to do a whole lot of stuff.
No, I could hardly, just getting up and down out of a chair and even walking was very painful.
Yeah, so
Just not being able to do simple things, I couldn't go out and ride a bike. I can't go, couldn't go on a jog. Lots of just little everyday things, doing yard work was very difficult after, even just 15, 20 minutes.
yeah, yeah.
I didn't realize there was a, stem cell therapy and whatnot here in town. And so, yeah, I was looking at, the surgical options first and seeing, the prices on that. But then I seen a Facebook ad promoting that there were, these options here. And so I decided I was going to take a look at this first before, surgery was obviously going to be a much longer recovery than getting shots. So it's like, I might as well check out the shots first.
Awesome. So, and we did PRP therapy.
Correct.
We also did some stem cell therapy. We did lasers. We had you strengthen up that leg. Really important. And of course, we had you do the diet, which is pretty critical for all of this to work, right?
Nothing really. I mean, it was mostly just like, what if it just doesn't work? That was kind of just the main concern. But I mean, got those first shots, and within the week, I could already see a huge difference in just my balance and overall just feeling in the knee. They're pretty good, everything, besides drawing the blood because I'm a little guy. So that was a little intense, but everything else went pretty smooth, It's just a little sting in the knee and then it's all over. I just would take the rest of that day off work, and just kind of let the swelling down. But the next day I was back at it.
And you went back to work the next day after these procedures.
Correct.
I want to make it clear that Matt was in a brace for a period of time. We did have him braced for about 6 weeks.
Correct.
But other than that, didn't limit your activities at all.
No.
Got it.
It's great. I can do pretty much all the things that I could before, and my knee has no pain anymore. And I feel great, man.
Awesome.
Awesome. Run, jump. Before I couldn't even get down on my knees or else it would pop out of place. And now I can do that without even thinking about it.
Oh, that's awesome, man. I just love to hear that.
Absolutely check it out before the other options here in town because it was great, man. I struggled for a long time to try to find somewhere that could help me, and you guys were on it immediately. So everybody here is very respectful and nice, and they make sure you're taken care of. So
Thank you.
nothing but good words for you guys.
All right. Thank you, Super Matt.
Thank you.
Everybody come see us.